First, let's talk about the Brady arrhythmias. In the Brady arrhythmia, we have the sinus pause. It is also called as sinus arrest or the sixth sinus syndrome. Usually, the patient would approach to you asymptomatic, or because this is a bradyarrhythmia, he may have bradycardia, decrease in the heart rate. Due to decrease in the heart rate, there can be decreased cardiac output, so he can have syncope, fatigue, and weakness. The patient sometimes can have alternating tachycardia and bradycardia due to sympathetic stimulation. Hypothyroid patients. These patients usually have low heart rate. They can also have this bradyarrhythmia. And people who use beta blockers and calcium channel blockers, they can also have low heart rate and so bradyarrhythmia. In the Ecg findings, we will see the Ecg finding is seen due to temporary cessation of the SA nodal activity. The heart rate slows down, and suddenly can stop for a minute. In the Ecg findings, we can see the regular PP interval and a sudden pass. There is an absent complex, but the absent complex is not a multiple of the PP interval. I'll show you what it is in a second. Then for the treatment, we'll use pacemaker implantation if patient is symptomatic. The pacemaker just increases the heart rate. If you see here, this is a P wave and this is a P wave. If you see the distance, that is the PP interval. There is PP intervals and suddenly there is an pause, that is there is an absent complex. There should have been an ECG wave here, but it is not there. This is sinus pause, and this absent complex is not a multiple of the PP interval. If you see here, the distance between the PP interval is 1 box and 2 box and 3 box, almost 3.5 boxes. But if you see the distance from this P to this P, it must be a multiple of 3 or 3.5, but it is not. So that is what we mean by not a multiple of PP interval. This is sinus pass. Then we'll see about the SA nodal block. Just like the sinus pause, these patients would also have the same symptoms, or they can be asymptomatic. In the ECG findings, we can see mainly about the second degree SA nodal block. The SA nodal block itself has 3 degrees, the first degree, second degree and the third degree. The first and third degrees SA nodal block are not seen on the surface ECG that we use in the clinics. The second degree SA nodal block can be seen in the ECG. So the second degree block is further divided into type 1 and the type 2. We will see these things in the ECG. The treatment is pacemaker again if the patient is symptomatic. The second degree type 1, the patient will have progressive shortening of the PP interval and then suddenly there will be a pass. If you see, this is the P and P interval. This is a P and this is a P. Again this is a P. This interval will reduce, will shorten, and suddenly there will be a pass. This is second degree type 1 SA nodal block. The second degree type 2 SA nodal block is the PP interval that would be regular and there will be a sudden pause. If you see this PP interval, this is a multiple, the absent complex is a multiple of the PP interval. Earlier in the sinus block, we saw that it is not a multiple of PP interval. But if you see here, this is a P and this is a P. The distance between this P and this P is half a box here, 1 box, 2 box and another half box. So it's totally 3 boxes. If you see the distance between this P and this P, it is 1, 2, 3, 1, 2, 3 and 1, 2, 3. So it is a multiple of the distance of PP interval. This is SA nodal block or the sinus exit block. Then let's see about the AV nodal blocks, which are also types of Brady arrhythmias. In AV nodal block, again the patient can be asymptomatic or can have bradycardia and all other problems that we saw on the other types of bradyarrhythmia. Here, the AV nodal blocks are usually called as the heart blocks. These are of mainly three types: first degree, second degree, and the third degree. The treatment here is again pacemaker, but if asymptomatic, there wouldn't be any treatment needed. The first degree AV block, the PR interval is just prolonged. If you see, this is the PR interval. This is P, this is QRS. The distance here is the PR interval. In every beat, the PR interval would just prolong. So this is first degree AV block, just the prolongation of PR interval, and there is no absent complexes. In the second degree, we will see type 1, that is Mobitz 1 or the Wenke back. Here the PR interval progressively lengthens and there is an absent beat. If you see here, the PR interval is progressing. It's lengthening, and suddenly there is a drop beat or there is an absent complex. Again the patient will have PR lengthening, and suddenly a drop beat. That is second degree Mobitz 1 Wenke back for you guys. The second degree Mobitz 2, here if you see, the PR interval here is constant. It is not lengthening nor it's not shortening. It is constant, but suddenly the patient will have a drop beat. This is Mobitz 2 second degree block. The third degree block is also called as the complete block. Here the PR interval and the RR intervals are constant. This is the RR interval, it's constant, but there is no relationship between the atrial and ventricular activity. If you see here, the RR intervals are constant, but if you can't see a proper P wave or a T wave. These are just haphazardly arranged. This is third degree or complete heart block.